We've been coming to you either live from my home, where we kicked it all off with a dream, and then sometimes we've been at Mark Anthony's, but just right here on my phone. Let me tell you, I was the quickest change artist today because we just wrapped up our workout with the girls that we do on Wednesdays and Fridays right here in Kirkwood at Jefferson and North Kirkwood Road. We're going to feature Kirkwood today because, as I've been telling you throughout the week, we're going to have Dr. Sara Franco on from InVita Health and Wellness. So it is the Real Monica Adams podcast, brought to you by InVita Health and Wellness. I've told you about my friends there, but today I'm going to introduce you to the woman and the brainchild. So thank you for tuning in. We are live from North Kirkwood Road, South Kirkwood Road, I guess I should say, Kirkwood and North Jefferson, in the Kirkwood area right here at Mark Anthony's. And I've been telling you about InVita Health and Wellness. I've been saying some of the things that I love that they're offering, but I told you today that I wanted to bring the woman behind it all. So come on in, come on down, like the Price is Right. We have, how are you?
I'm doing well.
Good
How are
to
you
see
doing?
you.
Good to see you as
Haven't
well.
seen you in a few weeks.
It's been a
It's
little
Dr.
bit.
Sara Franco, and she is behind InVita Health and Wellness, 333 South Kirkwood Road, right?
Correct. Suite 300. We moved up a little bit.
I love it. So you were, when did you officially open your doors?
So officially on December 19th, 2021. Very short period of time for 2021, and then really tried to get things going in 2022.
Yeah, and we were just talking about the pandemic and how, I mean, here you are, you're opening in the pandemic, which was very hard for any business. Tell me about the strife that you went through with that.
Sure. So like Andrea was mentioning, I'm a nurse anesthetist by trade. So I work at WashU in their Department of Anesthesiology, and like all nurses everywhere and medical professionals in general, the COVID just really took a toll on us. And I was part of the COVID team along with a number of my cohorts. And, it really, prior to opening InVita, which was kind of my passion project, prior to that, it was a year of knowing that you were one of the last people to see somebody alive,
Yes.
Possibly one of the last human interactions that patients had, and it really took a toll on my mental health. So my husband, who is very supportive, was like, maybe it's time to kind of step away just a little bit and go ahead and pursue your passion project, which at the time was very much centered around mental health, chronic pain management, things like that. And I really wanted to open a ketamine clinic. So that was kind of what kicked off InVita. And then, it typically takes a little bit of time to develop that kind of practice, get your name out there, get some physicians on board with what you're trying to do. It's a newer concept. And my medical director, Dr. Schlecht, and I were both trained in aesthetics and had a very passionate feel for functional medicine. So we kind of devised this strategic kind of 3-tier plan, which is how we structured InVita. So we have kind of a functional medicine track, we have an aesthetics track, and then we have an IV hydration ketamine track as well.
And the ketamine is what we've discussed a little bit. I even had a woman that was leaving this morning, and she's like, I want to know more about that, because again, you can sit there and Google it and say, oh, I know a little bit, or oh my gosh, I know somebody that's really been affected. And that's what we wanted to discuss today. If you're just tuning in, we are we're in Kirkwood at Mark Anthony's. We are talking about InVita Health and Wellness, and you're going to hear a lot. You're going to see this woman a lot and talk about the amazing people whose lives are being changed by ketamine and by other aspects. We're talking about people who have mental health. We're talking about depression, thinking, Sara, that they would have to live their whole life that way. And it's just that darkness. I mean, one of the reasons I started this show was that mental health has to be put at the top of that triangle of life that I always discuss. And then your mental, your spiritual, all blending together. And hopefully you're also taking care and moving and doing the physical side. But when you are really suffering, it has to be front and center. And then you have to look in every way you possibly can to say, this isn't the life that I want. So let's first talk about what ketamine is, and then who is it helping?
Okay, so what ketamine is, and just to start off, it's a very old drug. It's been around since 1970. So it's one of the first anesthetics, intravenous anesthetics that were used. But the class that it falls under is actually called a dissociative anesthetic. If you think about other medications like propofol and things like that, those are more hypnotic. So we administer those to patients. They fall asleep. We often take over breathing for them, things like that. Ketamine actually causes kind of a dissociation in the limbic system. So patients are still aware, but they aren't feeling pain. They aren't able to control a lot of aspects of things. So what they found long ago was that, and I say long ago because it's relatively newer here in the Midwest, but this is really a field that's been being studied for 30, 40 years as far as using psychedelics for different aspects of medicine. But what they found was that patients that received ketamine intraoperatively were waking up feeling better than if they had received just opiates alone. They were reporting longer pain control. They were reporting that they took pain medication for a shorter duration of time after surgery, but then they also started reporting some other mental health side effects. Their depression was better, anxiety was better. And ketamine, we have found, it started off really being more for treatment-resistant depression. It was kind of end of the road after patients had really tried everything. And the mechanism by way ketamine works for mental health, we're using it more and more and more, and sooner and sooner and sooner in patients for a treatment option for them. The nice thing about it is because it's very safe, it works on a receptor that not many medications work on, and that affords the ability to really not be contraindicated for most patients. We use it in pregnant patients, we use it in elderly patients, we use it in pediatric patients, so it's just, all in all, it's a very safe drug.
Okay, that was actually going to be my question, is from an age standpoint. So what is the youngest that you've used this on?
We treated one patient that was 9.
Wow.
Now that is very rare for us. Their pediatrician and actually their pediatric psychiatrist was present with us during treatment. But this was a 9-year-old patient that was suicidal.
That's just what I was going into, Dr. Sara. So again, this is Dr. Sara Franco with InVita Health and Wellness. I was just having this discussion of looking at the world and just, okay, let's go back to the beginning of the pandemic and everything shut down. Kids went home, no socialization, the way they were learning. They are stunted in their growth on many levels. They're trying to go back right now, trying to find their way again. But you're talking about 2.5 years of a very impressionable age, and we had dark depression, mental health, and suicide rates in our youth like we've never seen before.
Right.
And it was, parents, grandparents, educators are lost, thinking, well, how do we even start to address this? Because it's years. We're talking 2.5, maybe 3 years
Right.
of them being affected. And here you are saying, a 9-year-old of things we never would think they'd have to go through. But we're talking about bullying. Let's address that. Bullying on so many levels. In my life coaching, I talk about where they're, if someone's overweight and they're trying to lose weight and where it's being hung on to from the past, right? So we start getting into abuse, domestic abuse, sexual abuse, physical abuse, and then the bullying starts to rear its ugly head because it was suppressed for so long, and bullying all the way back when we were kids. But now, as we all know, bullying is not just in front of each other,
Right.
but that social media aspect
Right.
of bullying, right? And that's where the kids aren't talking. Hopefully the parents would take more of a vested interest to say, what's going on in the kids' lives. But here you are talking about from youth all the way up into seniors, something that exists for them. What age group was it actually started on, if you know, from way back when ketamine first was introduced?
So they used it very heavily in the military.
That's what I thought. PTSD?
Well, PTSD, and then also, out in the field, I know EMS is starting to carry it a lot more. Ketamine it hits so many different, it's an analgesic, it helps with pain.
Oh.
It is an anesthetic. I don't want to say it makes you not feel anything, but it makes you not care that you're feeling anything. So there's such a broad range that it helps folks on that there's just I would say probably since Vietnam, it was huge in Vietnam, and then ever since then it's just gained momentum as far as military, EMS, anesthesia, and then even in the emergency room, oftentimes if you break your foot and they have to reset it, then they'll give a patient ketamine in order to be able to do that, keep the patient comfortable, get them a little relaxed so that it's a little easier to do some of that manipulation. and then also make it where, it isn't traumatizing for them, where
Right.
they remember everything that happened.
So you mentioned earlier, and this might be, and I don't know, George, can you see like comments and stuff that come in? If you do, just shout to me if anybody has any.
I can put them up, yes. No,
Okay, if anybody has a question for Dr. Sara Franco, let me know. Can I just call you Dr. Sarah?
You can ask. Or just Sarah.
Or Sarah. So if you have any questions about it, because I know some people, as I've been mentioning it, they're like, well, this sounds like something that might be for me. I have a lot of people that have been tuning in over the last couple of months that just said, I'm taking all the tools that you're trying to give, Monica, and I'm trying to get myself into that positive state, but I'm in a deep, deep state of darkness and depression. You mentioned psychedelics. So if anybody's watching going, well, hold on, like, well, let's talk a little bit more about that.
Sure.
Let's go deeper into that.
Sure, absolutely. So there's definitely, as with mental health, there is also a stigma of, psychedelics. I kind of joke with patients, when patients come in, and it's interesting because I have patients that come in the deepest of depressions, and then I have patients that come in, and these are, this might be professionals, physicians, lawyers that are, it's just, they have some underlying mental health, whether it just be just some generalized anxiety, maybe some ADHD, diagnosed, undiagnosed, OCD, depression, and they're just kind of not able to get past that, and they're getting in their own way. I kind of alluded to it being, it was kind of the Hail Mary that we used when nothing else was working, but we're using it earlier and earlier in the treatment process, and it just keeps gaining momentum. So whenever I'm talking to them and I do the consultation, I kind of joke with them that ketamine, the experience that I had at one time during a C-section, not in the capacity in which I use it in the office, but it would be almost like if you had like ecstasy and LSD, and they kind of had a baby together. And that's very daunting for people.
Yeah.
But what I like to stress to them is one of the first questions I often get is, am I going to end up addicted to
Correct.
this?
That was my
right.
I was waiting for you to stop, and that was my next question.
So it's interesting. The addiction potential of ketamine is very, very low. There's only a handful of drugs that are, when you look at the schematic, that are less addictive than ketamine. Things like nicotine, alcohol, sugar, things like that are more addictive than ketamine. The abuse potential of ketamine, however, is very, very high, and that's why it's so regulated. It is a controlled substance for sure, but we just have to get people past that stigma that although it is classified as a psychedelic medication, it does very much have medicinal properties.
And there's a lot. We're just talking about ketamine, but I was talking to a veteran that's actually in our office the other day, and he was going through many levels. What does it start with? Iowa.
Hiawatha.
Yes, thank you. So, he was getting into things I'm like, I've never heard of it. He goes, Monica, these are all so helpful, but he's like, everybody wants to have that taboo stigma, right? How do you break the stigma?
I think more and more it's interesting when patients come in. Of course, we absolutely respect their privacy, and HIPAA follows, any kind of medical. But when patients come in, they seem almost embarrassed, just like mental health. Nobody wants to talk about, oh, there was one time I was depressed, or oh, I'm anxious and I don't want to get help for it. And they'll come in and they'll be very, very secretive and almost feel ashamed. And then by the time we have talked, they have had the treatment, our success rate is very high, and they leave feeling like they're more in control of the situation and empowered than I've heard a number of times. I'm going to be your evangelist for this drug. I'm going to tell everyone I know about this drug. This is the only thing that has helped me. So I just think the more and more patients that we're able to treat, the more patients that are like, you know what, I'm tired of feeling this way. I just want to try something different. Nothing else has worked for me. Then I think we're just going to continue to gain momentum. They're going to tell someone, and they're going to tell someone, and then finally it's going to, maybe it'll lose a little bit of the stigma that it has.
Yeah.
Also, just real quick.
So we're getting something from George as far as questions.
Yes. Someone was asking about prescription drug, whether it's prescribed and or can be given in supervision. Obviously, you're supervised.
So yeah, so the question, I don't think you can hear him in the background, but the question is from a prescription standpoint, and then how it's being prescribed, which is kind of where I would go in. the addiction standpoint, it's not something that they can just get anywhere, right?
Correct.
So, yeah. So, how often are they having this done?
So the way we really try to stick to, although there are studies being done all over, I mean, at any given time with this drug, as well as other medications and kind of microdosing some of those things, we really try to kind of stick with those tried and true protocols. So our typical infusion series, because we really like to, and without getting really heavy into the pharmacokinetics and pharmacodynamics of the drug, we really try to stick to the protocols that have been developed. So we do an infusion series to really get the patient where we want them, and then basically after that they come in for booster treatment. So we'll tell patients, you know, we're going to start you here, whether it be for depression or for pain. We want to get you up here, we want to keep you here, and if you start to feel kind of little dips there, then that might be a time that you need to come in for a booster treatment. Okay. Now, in order to maintain the patient, there's a number of things that you can do. Let's talk about depression. So we do not take patients off of their medications. They're able to take just about anything that they were taking prior to coming in. They continue to take. We do not alter the dosage of those. If there's something that they take that may kind of interact with ketamine, then we collaborate with their physician in order to do whatever is best for the patient. So either, you know, the ketamine can be, you know, I tell patients, this is likely not going to eliminate you ever having to take a medication again. I think ketamine fixes just about everything, but unfortunately sometimes there's a chemical imbalance that's completely beyond your control. This is not going to correct the chemical imbalance. But what ketamine does do through neuroplasticity is, and just a very cliff note background, what happens when you have anxiety and depression is you have these receptors that are just firing, trying to get your own neurotransmitters to bind to them so that you're not feeling depressed. So dopamine, serotonin, norepinephrine, these kind of, you know, these neurotransmitters. Eventually these receptors just burn out and they're not receptive anymore. So with ketamine, what we do is we get the brain to turn those receptors off, but the brain needs receptors, so then the brain will make new receptors. Well, these are nice, new, healthy receptors. So now either your own endogenous neurotransmitters, serotonin, dopamine, that your body produces, are able to bind and relieve depression and anxiety and things like that, or the exogenous medications that you've been prescribed are able to work on those. So what we have found is either patients maybe do not need the medications anymore, maybe need a smaller dose of the medications, or at a minimum, these medications are now working on these nice, healthy receptors, and patients are finally starting to find relief. You know, I tell them in treatment, it's very sad that this is thought of as kind of a last resort, because in the meantime, and you know, antidepressants, it takes a minimum of 3-4 weeks for them to even potentially begin to work. If they don't work, then it takes 3 or 4 weeks to safely come off of them, where you know, you're essentially watering a dead plant. You have these receptors that you're throwing drugs at that very well may work, but you have receptors that are not receptive to those medications. So now you have a patient that is just wanting to feel better,
right?
And they're taking Prozac, and they're like, well, Prozac didn't work for me. Well, maybe it didn't work for you because you were taking it and it was interacting on a receptor that wasn't working anymore. Yeah. So we get the brain to make these nice, new, healthy baby receptors, and now this treatment-resistant depression is not always treatment-resistant.
This is fascinating. Again, so if we have any questions or comments, I'll ask George, since I don't have anything in front of me like I normally do to fire back and forth with you. But I know a lot of you have been hearing me talk about it. Maybe you've done a little research into it. We're talking about ketamine, and it's offered to you at InVita Health and Wellness. You mentioned earlier, and this is the thing that, from a trust factor, you have a long storied history with anesthesia. So I think that really is something that you would want someone to be thinking about. If they're thinking of having this, it's not just go anywhere where anybody's administering it, but right? It's the trust. To me, it's the trust factor of why people are watching and why they'd want to come here.
Okay. Rose is asking a question. She has an 80-year-old friend.
Rose has an 80-year-old friend
with Parkinson's.
With Parkinson's.
And extreme anxiety.
And extreme anxiety.
No meds are working.
Okay, so she's wanting to know if this would be good.
This is potentially a treatment option. So I had mentioned before contraindications to the drug. Ketamine is what we call a sympathomimetic, meaning it mimics the sympathetic nervous system. So we expect to see increases in heart rate, increases in blood pressure, which we're prepared to treat there. But as long as the patient does not have unregulated, unmedicated, uncontrolled high blood pressure, aneurysms, things like that, it's not contraindicated. We're able to administer it safely. So an 80-year-old patient may very likely be a candidate for ketamine treatment. And interestingly, the Parkinson's, we've talked about mental health, we've talked about chronic pain, but some of the neurodegenerative disorders like Parkinson's, ALS, even things like Alzheimer's, things like that, they're finding ketamine and other psychedelics to be very beneficial in the treatment of those. I actually had a Parkinson patient that came in for Parkinson's depression. 3 treatments in, his tremors completely stopped.
Wow.
Now, I have absolutely no scientific reason that happened. But, he said, well, can I quit taking my Sinemet? I'm not going to tell you to quit taking your Sinemet. I was just happy that he was, he wheeled in a wheelchair because he wasn't able to walk anymore, and then he walked out with a cane. So, that was a win all the way around for us.
I mean, that's it, right? Isn't that what we are here on earth? We want to, I would hope that all of us want to give back and help in any way we can. She's blessed to be able to help you in that medical side. I'm sure the question on many of your minds, let's kind of just do a little recap. So we're coming to you again from the InVita Health and Wellness mobile studios, our studios. I'm getting very excited.
I'm excited.
I don't know. Is it possibly next week?
It could very well.
Woo! He's saying it's very well. So George and Michael, I want to give a shout out to. They are so incredible. He's worked so hard over the last several months to bring this to light, to bring this to you, so that we can work on your mental, your physical, your spiritual state, make you the version of yourself that you were meant to be, take you out of this darkness and depression, talk about these real life issues. I think that is the one thing that the pandemic did allow us to do, was to bring mental health to the forefront and for people to say it's okay not to be okay.
Absolutely.
But don't just stay and think you have to suffer in that kind of silence. Right. And that one of the reasons that I was blessed to have Dr. Sara come on with us, and thank you, by the way, to you and your staff.
Thank you for having me.
She is our title sponsor. We sat down, I just got chill. We sat down for about a year and a half or 2 years, an hour and a half or 2 hours, and talked and just realized how much we are in common with wanting to help the world. And I said, that's it. That's who I want to align with us. So you're not just going to hear any type of sponsors on this show, because if it doesn't align, it doesn't make sense. What I want, though, is for you to know the person behind the service. So we can go anywhere in life and have a service out, or go to a retail store and buy something. But wouldn't we all want to go and patronize a place when we really know the heart and soul of the person, know their character, which you're going to get to know much more about her coming forward. How many people do you have on staff with you?
I have 3 full-time staff, and then a handful of part-time staff, and some nurses and paramedics that join us for some of the pop-up events and things like that we do.
Okay, and it's InVita Health and Wellness, 333 South Kirkwood Road. What is the name of the building that you're in? Do you know? Is it?
So it's Pioneer Place.
Okay.
Everyone calls it the bank building. They're like, you're in a bank. I'm like, well,
Covered by insurance.
That's where we were going. So it's not, right?
It is not covered by insurance. No. And then someone had asked about a prescription before. Unfortunately, Big Pharma, ketamine's been around for a really long time. Yeah. There's really no financial incentive to reinvent it. So what we're doing is very much an off-label use of ketamine. We use drugs all the time, off-label use. But because of that, most insurances do not cover it. As far as a prescription goes, we do prescribe maintenance, and there's the new Spravato that is out, which is S-ketamine. It's an isomer of ketamine. It's very similar. It's like ketamine's fraternal twin, maybe, but that can be prescribed, but it's still an FDA clinical trial, so it's very heavily regulated. You have to come to the clinic twice a week to have it. You have to stay there for 2 hours. So that becomes very prohibitive for patients because you're not able to drive after, so you're going to have a ride, things like that, and that becomes very burdensome to them. We do use some compounding pharmacies to make ketamine nasal spray that you can use at home as more of a maintenance treatment, but it's a C3. It's very much a controlled drug, just as hydrocodone or Xanax or any of those kind of medications would be. So it is definitely something that you have to be prescribed, and there's very heavy oversight for it. So
Okay, so what about, and I know this was a question that came up that somebody wanted me to ask. So since we're talking about a psychedelic, if someone they're employed and they're drug tested, that would be an issue, correct?
It would absolutely show up, but we would be able to provide
Okay.
documentation, just as if you were taking, hydrocodone or Xanax or
Okay.
any of those medications, as long as what we're doing is, although it is an off-label use, we are still very much, an accredited facility. So we would be able to provide the documentation that you would need for your employer of why you would have that particular medication in your system.
Okay. Any big, because how many patients have you treated with ketamine?
Hundreds.
Hundreds. Anything, I mean, gosh, it's kind of like picking your favorite child. Is there any story that you just want to pass along that has been, I mean, the Parkinson's one's a good one, but anything from a mental health side that you can think of right now in the hundreds that you have treated that would really make them say, wow, that's what I want for me?
I mean, I wish I would have brought some testimonials. My husband jokes around that, I mean, and not joke like haha funny joke, but he's like, you are, this started off just a clinic that you just wanted to do, and you're changing people's lives, and I can't say, I want to give a shout out, if I can, to my staff, because
Yep.
without them, none of this would be possible. I have some of the most dedicated, committed nurses and other healthcare professionals that I've ever had the pleasure of working with, and they
Awesome.
absolutely make it possible. And the patients grow to love them. They come in, they see the same faces all the time. We don't just have people just in and out of there, just random people. It's the same faces. We get to know their stories. They hear about our crazy kids and husbands and spouses and partners, and we really become like a family. It's really hard to choose, just one. I had a 77-year-old gentleman who came in and he said, I just want to figure skate again. I love ice skating. I love walking. The pain in my back has gotten so bad. I take pain medication and it doesn't really help it. And it makes me loopy and all the side effects that go along with it. And now he's ice skating again. It's those little things. It's getting the letters from the parents after I remember I was on my way to a board meeting and took an after hours call and ended up pulling over and talking to a mom for 2 hours. She said, my daughter was just discharged from the hospital. She had to undergo ECT treatment. She's still horribly depressed. It's not controlled at all. I don't know what to do. We've tried everything. I found your clinic. I called a number of ketamine clinics, and you're the only person to call me back. And I mean, we laughed before we even met. We laughed together. We cried together. And she was so worried about her daughter, and her daughter was so tired of feeling as bad as she did, that she came and got treatments and went back to graduate school. Mm-hmm. So it's just this never ending. I get emails and letters and things every day. You saved my life, or now I am able to, and it doesn't have to be patients that are in this deep depression.
Right.
I had an attorney come to me and he was just like, I can't get it together. I don't know what to do. I don't know if it's depression. I don't know if it's anxiety. And those two comorbidities go very much hand in hand. I'll have patients that come in and say, oh, I'm not depressed, I'm just anxious, or vice versa. And we do, a handful of kind of standardized testing, and, they think they're depressed, but their anxiety is just off the chart. Mm-hmm. And oftentimes depression is like this wet blanket that is so overpowering that once you lift the depression, there are other, kind of things that you need to address and work through and get past. And, so this attorney came to me and he was like, my relationship with my wife is very strained. My relationship with my partners is very strained. Mm-hmm. I need to do something different. And we did a series of 6 treatments on him. And I say 6, 6, we know it takes 3 treatments to get those receptors turned off, at least 3 treatments to get receptors turned back on, but sometimes it takes 8 treatments or 9 treatments. So we always kind of, we let patients know that could be kind of a moving endpoint. But after his 6 treatments, he left, and he definitely felt better. We do the same standardized test each time you come in to see that score coming down. That's what we're waiting to see, because if not, then it's not effective, and there's no point in continuing the treatment. But the score continued to come down, and about 3 weeks later, and we tell patients, we're not going to reach out. What are you doing? How are you doing? Do you want to come in? We hope if we never hear from you again, then that's awesome.
Absolutely.
Then you're doing great, and you've moved on, and you're functioning in life. And, I got the email. No one wants to get an email from a lawyer, and it was this really long email, and I'm like, oh, okay, let's see how this is. So I start reading it, and it was like, I feel like my brain has been completely decluttered. I am able to, before I had so many cases to prepare for, I didn't even know where to start. So I just came up with every excuse and didn't do any of it. My wife and I are on a completely different level now. He had a very young son. He's like, I'm able to take my son to the park and actually enjoy it and be able to focus on him and not just be wrapped up in all the things I should be doing. And, even though this is fun, I really should be preparing for this.
Mental clarity.
Exactly. And he was like, I'm going to tell I'm going to tell everyone that I know. I wish I would have done this sooner. I think the more and more of those stories that we hear, that's going to resonate with people. And I mean, I've gotten to the point where I feel like that really ketamine could benefit everyone just a little bit.
Well, when we talk about trying to, let's just say the word and watch what happens to all of you that are watching. Meditation. Oh no, everyone always sits there and goes, I don't even know how to shut the brain off, right? Because that's the biggest thing. Clutter, debris, trying to get that out of the way so you can find mental clarity to have the best relationships, so you're the best employee or employer. Every aspect of any type of relationship, friendships, business relationships, romantic relationships, your parental, sibling, etc. If you don't have that balance that we're looking for, then you're not truly living the way the receptors are wanting us to live, right? Dr. Sara Franco, once again, we were talking about InVita Health and Wellness, and it's 333 South Kirkwood Road. So for ketamine and you have so many other, we're going to be talking about a lot of services that they offer as well. It's a medical and a wellness spa center. They have in this. Take us on the next step.
Absolutely. So you would just give our office a call and let them know that you want to set up a ketamine consultation. We have kind of a welcome packet that we've put together to just kind of give you an idea of what the expectations would be, the handful of medications that can have, I don't want to say an interaction, or it doesn't make it where you can't have ketamine therapy, but we may have to adjust maybe the time of day that we do it so that it's so many hours after your prescription dosage has been taken of medication. But we would send this welcome packet to you, let you take a look at it. It has a health history and everything that you would fill out. And then basically you would set up a consultation with myself.
And then how long after that would they come in? Is it shortly after that consultation, or just depends on scheduling?
It really depends on scheduling. I've had, I think one of the important things about ketamine is that you have to be in as good of a place as you can to get started. It's very much a mindset. So we really try to, we have multiple ketamine treatment rooms now since we've expanded our space. So the flexibility as far as scheduling is definitely there. But in addition to that, we try to let patients set as much of the schedule as they can, because the last thing that you want is when you're already worried about everything.
Stressing about that.
Is being like, how am I going to get here, and who am I going to have to bother to come and get me? So, am I going to have to take off an entire week of work? The answer is hopefully not.
Right.
We can schedule your treatment a little bit later in the afternoon, where at least that morning you can have some productivity. You're probably not going to be wildly productive after your treatment. So you'll have the whole morning that you can get things done. Or maybe you need to do it in the morning. You need to drop your kids off at school. Your spouse will be home in the afternoon, so you can get the kids to school. You can come in for the treatment. you can have the treatment, come home, take a nap, and although you would have someone else to help you watch your children, ideally, then but you would be rested up enough to not just be, very tired and unproductive for the rest of the day.
Sure.
So I think that flexibility definitely relieves a little bit of stress for patients. But in all honesty, I had a patient last week that came in. We did the consultation and we did a treatment later that day.
Oh.
So they're very much, it's something that we can definitely schedule out, or something that we can really try to get you in as soon as possible.
All right. So again, we're talking about InVita Health and Wellness, and this is how real the Real Monica Adams show is. So Leah Faye, who does some esthetician work and hydrofacials, etc., right behind us. Do you need to get to your office?
Yeah.
Come on back. Go ahead and come behind us.
Come on
So
behind us.
she's going to get to work like we're all getting to work. Speaking of which, hydrofacials, you also do so many other things that we're going to discuss in future shows together. What is the, go ahead and walk behind us, Leah. What right now, in the time that you opened in 2021, has been the biggest service that someone's come to you for?
I think ketamine definitely, just because, we had kind of alluded to, you don't want to just go to anyone to have it
Yes.
done. I think the fact that I and Dr. Schleck both have, between the two of us, 60 years in anesthesia experience. He more so than I do, but
I was gonna say, you're too young.
But thank you. It's 14 years for me, so you can do the math there. But we're very, very comfortable with the drug, and unfortunately, there are different avenues that you can take to add ketamine service to what you're already offering, and it doesn't, any physician can do it. And not to say that other physicians are not qualified, because I want to be absolutely upfront that that's not what I'm saying. But I mean, this is a medication that we use literally on a daily basis in anesthesia. For a lot of us that work with, I work in OB and do some OB, I do some trauma, I do some.
Right.
But we are very comfortable with the drug, and you're very, very safe coming to the clinic. But so I think that sets us apart a little bit from any other clinic in the area, as well as the fact that we're very responsive. In addition to that, I would say that some of the other treatments that we offer, we do high dose vitamin C that has shown some great success for cancer patients, for post-COVID syndrome, for post-mastectomy syndrome, things like that. I do a handful of blocks. We do what's called an SPG block. It's a sphenopalatine ganglion block.
That block.
Okay, the one that you talk about all the time.
SPG.
SPG.
We're good friends.
SPG is a lot easier to say. But for patients that have migraines, it may save them a trip to the emergency room where they're going to have to start an IV, probably give you a handful of medications. This is something very quick and easy that we can do. It's very safe, highly, highly effective, and we can have it, everything taken care of in 20 minutes or so. Ironically, it also brings back the sense of smell for a lot of patients that lost that in COVID. So we've really been doing a lot of work with that. IV hydration has become very, very big.
Yes.
You see these places popping up all over the place.
And you don't know who you can trust.
You don't know who you can trust. And you just have to make sure that things are being done in the right way. So one of the things that we do at InVita is we do custom blend our IVs. So we don't just order these vials that have like a set amount of vitamins. Everybody gets the same thing. We do things that are weight-based. If you want, say, a Myers cocktail that has just kind of a plethora of vitamins in it, but you also want some extra biotin for your hair and your nails, then we're able to do that. So I think those services are they're very, very popular, and probably what sets us apart from other med spas, in addition to, you know, the lasers and
Sure.
and microneedling and things like that we do there. So.
Well, and again, there's a lot, as you just mentioned, and as we do our wrap up, that is what a lot, as you just said, is happening in our world, that people are just popping up. Oh, let's do this. Oh, let's open up another one. Oh, they're doing good. Let's open up another one. Right? It's all these medical spas. But the reason I wanted you to align with us and be our title sponsor. So InVita Health and Wellness is our title sponsor, and you're going to see Dr. Sara Franco and maybe some testimonials, maybe bring some patients in. We're not even going to touch on it today because there's a whole nother level of a topic of what you're doing for cancer patients. You mentioned it a bit, but we'll talk about that. I've been talking to your manager, Jamie, which, by the way, is where this relationship started. Thank you, Jamie. We love you, Jamie.
Everything. We love you, Jamie.
We do. Jamie, I've known for years. She used to be one of my clients that I used to personal train. It's just organically how things happened, that she reached out, and I wouldn't have even known about you. She reached out and said, I love this woman I work with. She reminds me of you, and I hope for those of you that have followed me for 30 years, you see the heart and soul in her, and her husband saying, like, oh my gosh, you're taking care of the world. And doesn't that make you feel good inside?
It does.
That if we were to leave this world tomorrow, that we know that, well, we did what we could to give back.
Absolutely.
As much as we possibly could.
Absolutely.
I'm going to separate my seat for a second. I'm going to grab a book that we're going to wrap up with. But anything else you want to tell them to welcome them into your clinic, and then give them the phone number, the address again, and then I'll be right back with my book.
Okay, absolutely. Sure. So again, my name is Sara Franco, doctor in the education sense. I have a clinical doctorate, but you can just call me Sara. So, so stop by and see us at InVita Health and Wellness. We have a multitude of services that we would be happy to explain to you and see how we could help you out. We're located at 333 South Kirkwood Road in Suite 300. You can follow us on Instagram at InVita Health and Wellness, and you could give us a call at 3.
Good on TV also, right? That's what we need. So you mentioned before, and I've been doing this for a week now, these books spoke to me when my husband and I went to the Crossing in Chesterfield, and looking for churches and finding our spirituality again, and just really connecting, because that's what life is all about. We went there, they had a bookstore, and he went around, was looking at a couple different things, and then first of all, color-wise, they're beautiful. So one's like purple and yellow and orange, and I was like, oh, that'll look great on our set. But I was like, 100 Days to Freedom. So Dr. Sara mentioned fear and anxiety, and that's something that many of you suffer through. So since she and I both work hand in hand in helping you to get past that, I just want you to listen, and this is how we want to wrap up the show. So this is day 2 of the 100 Days to Freedom from Fear and Anxiety, because we are mixing in. One is stress. One is fear and anxiety. There is depression. There is one that I don't have that's about overeating, and then there's one about anger. So instead of just doing 100 days of one, we know that they all, as you know, they all blend together. There's fear, anxiety, there's depression, there's stress, there's anger. So this one is the day 2, strong and encouraged. Don't be afraid, for I am with you. Don't be discouraged, for I am your God. I will strengthen you and help you. I will hold you up with my victorious right hand. That's from Isaiah 41:10. So when fear and anxiety have been ruling our days, it can be so irritating to have someone say, don't worry, just cheer up. It'll get easier, right? It's not that big of a deal. You don't want to hear that when you're in this fear and anxiety and depression. They may mean well, and they do, or they may feel ill-equipped to help you. But if it were that easy to just not feel the way that you're feeling, you wouldn't feel that way, right? It's not that easy. It's not the snap of a finger. No one wants to experience worry and uncertainty, yet it's become part of our daily journey, and even more so in the last few years. What do you do when you recognize that worry has become your default, or that your reactions are a bit over the edge? Many different types of anxiety can affect us, and it can be very important to seek help to understand the specific way that it's actually affecting you. So you might resist seeking help because, after all, that might cause anxiety as well. But beginning a plan to address what you're dealing with is so important to feeling better. Perhaps you have the strength to reach out for help today. It might be just a phone call to a friend. It might be a phone call to this friend right here to say, I think I need help, and you've been telling me about the help that I might be able to have for anxiety. Sharing these feelings with another for the first time may be the most difficult, talking about the fact that you're not okay, but we're giving you the okay that it's okay to say. When you feel anxious, you think nothing will help, you feel like you should know what to do for relief, well, trust that God will provide help and strength for you today. Worry is the antithesis of trust. You simply cannot do both. They are mutually exclusive. Worry does not empty tomorrow of its sorrow, it empties today of its strength. And on days when life is difficult and you feel overwhelmed, as you might often do, it helps to remember in your prayers that all God requires of you is to trust Him, be His friend, and find that you can do this. So today's prayer: Heavenly Father, give me the assurance of your strength and encourage me as I seek answers to the worries of my life. Help me to trust you with my needs. Amen. 100 Days to Freedom from Fear and Anxiety. And again, it's a daily devotional, and it just gave me a chill, so I know we're on the right path. Stephen Arterburn, thank you for these books. We are reaching out to Stephen to hopefully have him on the show as well, because I just absolutely love these. Thank you, my friend.
Thank you.
Look, I got chills and you got chills.
I know.
We got chills together. Thank you for what you're doing. One more time, location and phone number.
Okay, sure. InVita Health and Wellness, 333 South Kirkwood Road, Suite 300, and the phone number is 314-394-0950.
You will see her a lot with us. We've got a lot of things to talk about over the next several months, years together. We got this wonderful collaboration. InVita Health and Wellness, again, in Kirkwood. Reach out. This just might help you get out of that darkness and depression that you're in. I'd love that. And again, many other things that they offer. The website, InVitaHealthandWellness.com.
Yes, ma'am.
All right, so go to that. It's INVITA. Thank you, by the way, for tuning in today. We're going to wrap up for you, and I want you to have a beautiful, blessed weekend. And then remember, when we come back on Monday, we'll get deeper into your topics. Give me some more topics that you want me to cover. We've got some great ones coming up. Thank you, by the way, also for reaching out and giving me some organizations that we can talk to with some of these really deep topics that I don't want to handle on my own. George assures me that we are so very, very near getting into the studios, and I haven't been there. I haven't actually been there myself in the last week, purposely, because I don't want to see it until it's further along. So we'll be showing you that. Super excited to unveil that. We'll have a ribbon cutting. She'll be there with us. We'll bring her on, and we'll bring the staff on, all the people working behind the scenes, so we can introduce them as well. All right, go have a beautiful, blessed Friday. Have an incredible weekend, and we'll see you on Monday. Thanks so much.